Hey y'all, so we're in the office today doing procedures. I want to share with y'all about like liposuction. Like, how does it work, right? We talk about tumescent and all, we just throw these terms out there. So tumescent, which I'm about to mix, is normal saline, which is how I make it. And then I use some lidocaine with epinephrine as well. Now, the reason that we do tumescent is because with liposuction, let's say you just take someone, you're doing liposuction, you just put the cannula in and you start sucking out fat. Well, you're going to have a lot of bleeding, right? You haven't actually done anything to separate the fat. So what tumescent fluid does basically is a solution that we make that has normal saline or lactated ringers, which are both isotonic. I'll talk about that later. But we also have lidocaine, which is for pain, and then epinephrine, which helps the blood vessels to kind of tighten and move out of the way. Now, the word tumescent actually means to swell. So when you put that fluid in, it actually kind of causes the fat to separate a little bit. But the other thing it does is it kind of almost makes the fat cells swell up so they're more visible to the cannula, right? So liposuction is a relatively blind procedure, so I always say it's just not simple, right? It's not like you just jump in like, let's just do some quick lipo, or you can learn it quickly. Like, it's very technical. But so we put that solution in, and what happens is we let that solution sit so that the lidocaine can simmer, kind of get to the cell membranes, kind of decrease the pain, that sensation. But also we put epinephrine that helps the blood vessels tighten. We let that sit for like 15 minutes, and then we go and do the liposuction, where we take a cannula and we actually pass it through the body, right, through the area that we want to get fat, right? So we go between the skin and the muscle. You don't want to go under muscle, because under muscle is the organ. So we go between skin and muscle to get that fat out. Now, here's the thing. When you put tumescent in, you don't get all of it out, right? So let's say you put a liter of tumescent. So imagine those Coke bottles, liter Coke bottles. Imagine you put that much of tumescent in, and usually the goal is to get that much of fat out. However, you still have some tumescent that's left in there that has to slowly kind of seep out. And that's why there's some drainage after liposuction. That's the whole idea why there's drainage after liposuction. And so there's different kind of things that tumescent does. The reason that we use normal saline or lactated ringers is really important is it's isotonic. So that means it has a similar concentration in terms of like the electrolytes, sodium, chloride, things like that your cells do. So what we don't want to happen is we don't want the tumescent fluid going into your cells, right? We want it to stay in that kind of extracellular space to really kind of cause the fat cells to swell and things like that. So that's kind of a little quick lesson on tumescent and liposuction. It really helps with pain. So especially if you're doing like, honestly, awake or non-awake liposuction, it really helps that patients don't really feel anything when you're doing it, because that tumescent solution has all that in it. So I'm actually going to mix that right now. Then we'll get started. But I hope that helps explain the idea of like liposuction, tumescent. What is it? Why do we put this fluid in? Why do I leak after liposuction? That's kind of the reason why, right? And that's also why we recommend massages as well, to really help that, when you think about liposuction, there's a small little hole that you use to do the surgery. However, the surgery area is really huge. It's really big. So the massages actually help to kind of help some of that fluid egress from the tissues, help with swelling and all that kind of stuff. Okay, y'all, a lot more to talk about, but that's it for today. All right, catch y'all later.